Hi, pals. We're just chilling here, ready to make a video. Okay, so you're hurting me. You're hurting me.
Alright, so the video you just saw, the clip you just saw, it was us at the doctor's office
A few weeks ago.
So we told y'all we were going to go get the counselor and counseling and all of that done. All of that was a success. Turns out she referred us.
Yay! So she liked us, and we aren't crazy.
Right.
Well, we're a little crazy, but we was good enough to hide it, so we could hide it from her. And she liked us, and we are cleared to continue on with our process.
So
once we left there, I called our fertility doctor the next day, and they said the next step for us was to buy some sperm, and we did that.
So, oh, you didn't even have a picture of me.
It's on my phone.
Oh, it's okay. It's whatever. I don't need to see our daddy, his daddy anyway. Okay, his daddy. But we went ahead and picked our donor. We were trying to pick a donor that was A positive because my blood type is A positive. But keeping it real,
we found somebody that we liked better.
Yeah, we found somebody. We found somebody that we like better. Number one, number two, his they had the bank that we went through. They had a sale going. They have a monthly sale where their donor of the month you get half off. So instead of us paying like for 4 vials, it would have been like $2,400. We paid like $1,400. So it was half off of basically buy one get one free basically. So his name is Kai.
We went through Seattle Sperm Bank. Our fertility clinic received our sperm, what was it, last week?
Wednesday?
So like what, the 15th or something like that?
Yeah, 15th.
So now we're just waiting for my cycle.
The moment her cycle comes on, it's go time.
They're going to send my prescription to my pharmacy. Pharmacy?
Yeah.
Pharmacy? That sounds crazy. I don't know why. They're going to send my prescription for my Clomid to the pharmacy so I can start taking that. After that, they're going to do a mid-cycle ultrasound to make sure everything looks good and my cycle is progressing how it's supposed to. And then I'm going to start doing my ovulation testing. Been there, done that. Can't stand it. But it's okay.
It's all done professionally now.
Then once I get the smiley on our clear blue digital OPK, then I'm going to get my IUI. This should happen sometime before October 8th or on October 8th. Because I have a fertility tracker on my phone, so if everything's going the right way, we should be inseminating the morning of like October 6th or 8th, one of those, I can't remember. But yeah, we're excited.
Very excited. Like, I'm super excited. Like, I'm so excited that
she bought prenatals this morning.
Like, but I'm like super excited. Like, I just hope and pray that it works the first time.
If not, we'll just be doing it again.
We bought 4 vials. It's like, I think it's like the place that we're going to. We'll post it below for anybody else who is trying to do IUI or IVF. Or need like a fertility clinic, like something like that, a fertility specialist. It's called ACRM, and it's Atlanta
Center for Reproductive Medicine.
Yes. Just looking at the paper, I'm like, what does it say? Yeah, Atlanta Center for Reproductive Medicine.
I definitely said that already.
And this is what their symbol looks like. So, they have like a couple of them in Georgia. The main one is like in Dunwoody.
They have support groups and all that good stuff.
So, I mean, it can be expensive, but I feel like it's all worth it in the end to have our little boy.
Or girl.
We're having a boy.
Or twins. Well, how about we have both? Let's just get both.
Knock it out at one time.
One and done.
Well, still gonna go. Anyway.
Kill 2 birds with 1 stone.
But yeah, so...
birth 2 babies with 1 pregnancy.
But yeah, so we're like super excited. Just can't wait for it to like start happening.
Yeah, I'm just excited. I've never been this excited for my period to start, so I'm just ready for it to start, so then we can start the process. Because we've been doing this it's what, September now. We start this process in April, so we're coming down to the last few.
Because we have to go get so much stuff done. Like we had to get blood work, HSG, like all the fertility testing, everything, all of that stuff. It just took so much time, and then we were working, and I was working all through the summer, so it was like we just really had that much time. And
yeah, we wanted to just enjoy our summer and relax before we really dove into this.
So now it's go time now. Like it's go time. So hopefully I pray everything works out good and we have a success on the first try. But I mean, we'll see. We'll keep you posted, of course. Follow us on Instagram, Snapchat, Facebook, YouTube. Like we'll try to vlog a little bit more along the process of IUI over this, especially over like the course of this next month. We'll try to like put out vlogs like every other day so you can know what's going on. Because she is scheduled to start her cycle like this week.
Tomorrow.
Yeah, tomorrow. So
hopefully it starts on time, because I can be like 3 days early, I could be 3 days late. So I'm praying it starts on time, because that'll just be our luck that it starts late and we're just so anxious for it to happen.
Right. So I mean, it is what it is. All right. So okay. So we're in here. She's about to get an ultrasound. This is the 3rd day of her cycle, so we have to get an ultrasound to make sure. Wait, what are they making sure of?
That everything's how what it should be. Like everything looks good.
Yeah. And then we're gonna go get some blood work done. They told her to undress from the waist down. Beautiful feet. And they should be coming in here soon. That's the ultrasound. So they're just gonna check, I guess, everything to make sure it's okay. And
they're gonna prescribe me Clomid, which is the fertility drug.
So yeah, everything should be good. Hopefully, we pray. Keep you posted after the blood work. We're not going to record the ultrasound because
I'm going to be wide open.
Right. So.
Well,
kind of wide open. But yeah.
There's lots and lots of those little black circles. There's probably about 17 over there. And I'm going to go scooch over to the other side. Let's see where our friend the left ovary is hanging. I'm going to be a little bit shy. There we are. Right here. And again, those little black circles you see all through there. And 12 on that side. All right, sweetie. Looks great.
Looks great. We got nothing but good news. And I'm just waiting for my blood results. They're going to call me later on today. And then I'll get my prescription and then I'll take it.
And we'll be on the next step and we'll be straight. Well,
we'll be gay.
We'll be gay, but we'll be good and gay. So everything went wonderful.
Wonderful, and the appointment cost $18.37.
It's because we overpaid for our last visit. It was supposed to cost like
$0.
Well, it was supposed to cost like $400, $400 or $500.
But they charged me $86 in the office, and then sent me a letter in the mail saying you owe $300. So I paid $386. They weren't supposed to charge me the $86. So the appointment was like $100-something today. And we got $86 off because they overcharged me last time. So, good day. And I'm not going to work.
You are going to work.
I ain't going to work.
It's 9 o'clock.
But we have to go to Buckhead.
We'll see if we're going to work. We'll see if she's going to work. I'm going to work regardless.
You're going to go to work. I'm going to go to work and sign in and sign out and walk back out the door.
We'll see.
No?
We'll see. Well, alright. Excited. Very excited. So
very excited. Very ready to get this on the road.
Very, very happy. So hopefully, I need to crank up the car. Hopefully, we'll, you know, 100% hopefully we'll be alright. I saw the car over there. But yeah, so deuces. Today, like a lot of good news. We just went and picked up the Clomid. You can explain what Clomid is.
Clomid is a fertility drug. It's I'm not exactly sure what it does, but they said that it'll help my follicles do whatever they need to do. And I have 29 follicles, so 12 in my left and 17 in my right, which is great. Apparently great. So,
and her lining in her uterus
is not too thin, and my estrogen level is where it's supposed to be, perfect. My cervix, my fallopian tubes, my ovaries all look perfect. So I start my Clomid on Friday. They have me on 100 milligrams. They have me on 100 milligrams a day for 5 days starting Friday, which is 2 days from now. So yeah, everything's good, everything's great. And after this, I have an appointment on Friday the 30th at 7:30 a.m. so they can do one more ultrasound just to make sure that the Clomid is doing what it's supposed to be doing. And that's it. So so the next appointment after the 30th will be our IUI. So everything's going, even though we had some drama this week with our fertility clinic, everything's going the way it should be at this point. So
everything is going perfectly. Like, so far, like, it's amazing.
Yeah. Even though earlier this week they stressed me out because they were like, we don't have everything. And
yeah, like, she called me crying, like, Monday?
Yes.
Because they were like, well, we don't have this, and this. Because she expressed that she was depressed, like, sometime in her life. And that time in her life, it was, like, 12 years old. And she just wrote it down. I don't know why she wrote it down, but
because I was diagnosed with depression. They said, if you have anything that we need to know about or you feel like we should know, put it down on the sheet of paper. So I said depression. I said endometriosis. I said everything that was wrong with me. So
right. I mean, I understand you didn't want to lie, so I get that.
Yeah, but I didn't want to lie.
But they were like, you have to go get a psych eval. And we're like, what? Like, a psych eval from like 14 years ago? Who's supposed to really, like, who can really say that, oh yeah, she's clear to go 14 years later? Like, that's not going to work. So I guess they went ahead and threw it out or whatever. And then they were like, we didn't get your paperwork that cleared you from the doctor, from the
counselor.
The counselor saying that we were, like, I guess, good or whatever to go. And we both had to go to it. And we're like, well, we've been sent that in. Like, we sent that in, like, September 1st.
Make a U-turn at Mount
that
Zion
was when,
Parkway.
You know, we paid $350 to go get that evaluation.
Right, so where's the evaluation that we paid $350 for?
I'm like, no, like, they need to shoot that, like, ASAP. So she went ahead and faxed it over, like, 3 more times, and then they finally got it. And we got the call yesterday saying that we could come in for the ultrasound. So she got the ultrasound today. We'll post the ultrasound as well.
It should be before this clip anyway.
Okay, well, we'll put the ultrasound before the clip.
But yeah, we also did genetic, what is it called?
Testing?
Genetic testing, just to make sure that I don't carry any, like, genes that can mix with the sperm donors genes that can make our child, like, have some kind of disease. So we're not gonna get the results until after we do the IUI, but in case we have to do it again, then we'll know what we need to do. So drive faster.
In 1.1 miles, turn left onto I-675 north.
But yeah, today I was poked and prodded, and then I'm gonna be poked and prodded some more. But that's okay. It'll all be worth it in the end.
Yeah, like, it definitely will. Like, I'm super excited. I'm, like, super excited. Like, words can't express how excited I am right now. But, yeah, well, I mean, we'll keep you posted, of course. We said we would. So,
keep the people posted. Keep the people posted.
So, I'm 675, not 70.
gotta figure out how to prop that up.
It'll get propped up. We'll find a way to prop it up. But yeah, so we'll talk to you guys later. And yeah.
And so yeah, at the beginning of this video, we told y'all that we were gonna put clips of us going to the therapist. We deleted them by accident, so you ain't gonna see it. Don't think we dumb. We thought we had it, but it deleted.
Yeah, it got deleted. So,
So we ain't got it. So yeah, we just
we'll apologize for that.
yeah, but you know.
I don't know how it got deleted, but it did. So, but I didn't delete it. But anyway, so we'll go ahead and we'll post all of that, and hopefully this video will go up like say it's the 21st.
In half a mile,
So hopefully the
turn
video
left
will
onto
be up by like the 22nd or
I-675
something like
north.
that, so we can keep it like current or whatever. But
The camera hates us, and goodbye.
goodbye.